Hello and welcome to the Tent of Ideas at the All in the Mind Festival online in 2020. My name is Leigh Johnstone. I'm the Artistic Director of Fluid Motion Theatre Company and All in the Mind Festival. And these discussions are all about delving a little bit deeper into some of the themes and topics being presented at the festival this year, as well as getting to know some of the people involved. In this discussion, I'm going to be talking to Dr. Tim Cooper. Tim is a GP at Chinham Medical Practice in Basingstoke, as well as clinical lead for mental health for the North Hampshire Clinical Commissioning Group. And we're going to talk about why the arts is good for your mental health. So let me bring him in now. Hello, Tim.
Hi, morning, Lee.
Hello, Tim. Hello, you're there. Great. How are you?
Yeah, not too bad, thanks. You well?
Awesome. Yes, I am. Welcome to the All in the Mind Tent of Ideas in a virtual space.
Yeah, it's a lovely day for it.
It's a lovely day for it. If only we could have that, the day in the background. But yeah, thanks for this. Thanks for chatting. What I do on all these discussions is sort of set a timer for 30 minutes, and then that sort of gives everyone the same amount of time really to talk. So I'll set the timer now, if that's all right, and we shall get going. I introduced you as one of your roles as clinical lead for mental health at the North Hampshire Clinical Commissioning Group. I'd just be good to just sort of tell people what that actually is and what that role is and what that's about. Because obviously you're a GP as well, which we all know what a GP does. But that sort of clinical commissioning side of things, it'd be interesting just to hear what that role involves.
Yeah, absolutely. So the commissioning group basically buys services for health across the whole of North Hampshire. So it holds all the contracts that look at things from sort of hospital services, general practice, other community services. Where my role sits is really looking as a sort of with a GP hat on, so with a clinical hat on, looking at the services around mental health and trying to see where we can improve or change or adapt what we're doing. So my particular area of interest is looking at how we work with mental health in primary care and trying to work out how we manage that moving forward. Because I think, there's a lot of change that we're seeing and there's a lot of support out there that we can start to utilise and put in practice. So I sit on some meetings where it's very sort of heavy, sort of contracting, sort of making sure people are meeting their targets and numbers, not really my thing. But then the other bit is really trying to think about how we look at bringing in other services to support our patients. And for me, that's the really exciting bit, trying to think about how we could work differently.
And so it's really, so it's about bringing your expertise, about being there face-to-face with patients and informing really the sort of decision-making aspects, the money sort of side of things in terms of what then you're able to do in the practice and across the North Hampshire as a CCG? Yeah.
Absolutely.
So what are some of the things that you've started to sort of explore around mental health then moving forward, different ways of working through that group?
Yeah, so one of the big things that we've done recently is we've started working with the charity Mind, who deliver a lot of our mental health services. They have fantastic people working with them called wellbeing workers, who are kind of trained professionals who are able to kind of listen, support, do a little bit of sort of psychological work with, but then they're also really engaged with their community elements. So I heard about this from a friend who works down as a clinical lead in Winchester. They just started using them and it seemed like a no-brainer. So we brought them up into North Hampshire. We tested it for 6 months or so, and the feedback from patients was overwhelmingly positive. And also the feedback from clinicians was overwhelmingly positive because it gave us another way of supporting our patients. So very much that was kind of a project that was run, demonstrated the effectiveness, and we now have wellbeing workers across all practices in North Hampshire, with different areas looking to increase the numbers as we move forward. So that's kind of one example of where we've sat. The other thing that I've been involved with a lot recently has been in sort of suicide prevention training. So looking at how we train and support our clinicians to manage conversations around suicide, how to support patients when they're sort of in that place, and rolling out a package of training for all sort of clinical and non-clinical staff across North Hampshire. And that's kind of gathering pace as we go, and we're looking at working now across the whole of the Hampshire and Isle of Wight at looking at developing a package of training to support all clinical staff, because obviously it's something that we know unfortunately happens.
Mhm.
And it's something where actually the conversations in a clinical world can have real value in terms of helping keep people safe.
Mm.
Um,
If we go, we'll talk maybe about the CCG again in a bit, but if we go back to sort of you, the person, and your interest in mental health as a clinician, as a GP, where's that sort of come from, that interest in? Because I know GPs have specific areas of interest.
Yeah,
Why
I
mental
think
health for you?
so. I think, like all things, it really depends on kind of your experience and where you've come from. So I was really lucky that during my training, I worked in Parkland, so in the kind of the mental health unit in Basingstoke. And my role, I was actually looking after the MOD, the military ward, because they have a 6-bedded unit up there. And like all things, if you have a great mentor. I worked with a fantastic consultant, Susie Carman, who works at Southern Health, and it was really interesting because I think one thing that you tend to see, certainly in your training, is you often have these small snippets of experience. So you kind of work with someone with mental health, but you never really kind of, once you've seen and sorted, you don't really see them again. And the thing that I learned on that 6-month placement was actually you were almost living with these guys, guys and ladies, and you could really see the impact of good quality mental health care. So whether that's from the medications we were supporting them with, whether the psychological therapy we were supporting with, working with them to work out what it is they wanted to do, that kind of really holistic element. You'd really follow people through that journey. And for me, I just came out the back of it being like, okay, you can actually make a big difference here. If you do it and do it well, you can actually really improve people's lives. And it was probably one of the more satisfying experiences that I've had during my medical career. So a good example would be we worked with people who had sort of, first presentation psychosis. So obviously really a scary place to be in, very upsetting for them. And it was just amazing watching them, come in very, very unwell and then walk out back to normal life, completely well. And that was just brilliant to see.
Brilliant. It's interesting. Obviously, this discussion is around, All in the Mind Festival is an arts festival. We've been going for 5 years now, usually in Eastbrook Park in Basingstoke, but obviously now all digitally for this year. And we sort of together titled this conversation, Why the Arts is Good for Your Mental Health.
Yeah.
So obviously we'll talk a bit about that. And sort of leading into that, you mentioned about the holistic nature of sort of treatment for mental health, and also thinking about social prescribing as well. It's a term that's sort of thrown out there at various sort of events we go to and seminars and webinars. People might not necessarily know what social prescribing is as well.
Sure.
Because I think that feeds into the conversation about how the arts can be used to help mental health. So do you want to also give a quick brief overview of what social prescribing is?
Yeah, so social prescribing, it's nothing more complicated than really looking at when you present with a problem, it's probably thinking about, well, actually, if we didn't look at something from a medical perspective, how else could we support you to support yourself? So the NHS like this concept, and basically we've started to employ what are called social prescribers, and these are just people who are very, very good people-facing individuals who have a really strong understanding about the support available within their community. So whether that's community groups, art groups as an example, other support that's available, understanding of how you can get financial support. So what we tend to do is we refer internally. We'll say, if you come and see me and there's a problem like that, we can ask our social prescriber to have a chat with you and try and unpick some of those problems. The reason it works is partly because anytime you present to a clinical person, we have to try and understand about what's happening in your life that's affecting what happens. So mental health is a plum example of, we know that everything that happens externally to us will affect our mental health. And if there's any way that we can manage some of those external factors, generally that can be a positive thing. But it's not just true for mental health as well. So physical health in particular, so people who aren't very active, if we can get them engaged in activity programs. We also know that loneliness and isolation can play a really big impact on people's physical and mental health. So trying to manage that. So it's really just trying to look at people as individuals and work out what other support we can get to kind of help them to stay well and keep well.
And I suppose it's linking all of those aspects together into one plan of action for that patient, rather than just necessarily giving them some pills and saying, see you later, see you in 2 weeks. It's thinking about, when they go home, what's the experience they're going to have at home, and how can we help that? What can we do to help them sort of come back in 2 weeks' time? Yes, they've had the pills, but they've also, had an experience that's got them out of the house for the first time in 3 or whatever. So that's what it sounds like to me, anyways. That's sort of thinking
and I
about
think
the whole.
definitely, and I think you're absolutely right, Lee. I think it's really what we're trying to do is make people less passive in their experience of health.
Yeah.
So recognizing that actually, you're totally entitled and you should be having you should be actively involved in your own healthcare, but there's also an awful lot that you can do as an individual to support your own health. And if we can do that, we know that there's a lot of good impact that we can have sort of on people's utilization of health services, but also about their general overall health and well-being moving forward. So they tend to stay more well if we can do that and do it well.
And obviously I wouldn't be here or running the festival if I didn't think that the arts had an important part to play in that. This might be a difficult question for you to answer, or it might be quite simple, but let me just put it to you straight. Why are the arts good for mental health?
Well, I think I was thinking about this before I came on the call today, and I think there's 2 things I would think of. So there's the first bit, which I think the arts is a really good way of us trying to express some of those deeper feelings that we have. Yeah. So one thing, we're seeing the conversation in this country get better about people recognizing mental health and being much more honest and upfront. I think what the arts does is it gives you a way of kind of either verbalizing or non-verbalizing those sort of that feeling of expression. So trying to understand actually, how are you feeling on a day to day? And some people are really good at it because they're much more open. Other people are a bit more closed. And so I think definitely that from that perspective, it's really important. The other thing I would say is obviously, so arts often exist within our communities. So they're often things that bring communities together, either in sort of shared expression, shared work, something like that. And what we know is that actually the more that we can do to empower our communities to look after themselves, actually that has a really big impact on health. So, if we've got thriving and resilient community arts groups that are engaging their population, working with our young people in our schools, actually will probably end up with a better health outcome moving forward. So for someone who works in a clinical world, for me, it's a no-brainer to support it.
I think for us, as for an organisation that obviously works in that area, in arts and mental health and well-being, for us, I think the challenge, but the exciting thing for us moving forward is to try and connect what we do to what you do. Because we've got a whole program of projects, for example, working with young people's mental health in schools. But sometimes, and very often, because of lots of different factors externally, those projects happen in isolation, and then no one ever touches them again, or those kids never get, there's no follow-up, or there's no sort of review or evaluation. We're trying to get better at that. And what Fluid Motion is doing at the moment is trying to think about how we make more long-term impact.
Yep.
But for me, there's got to be something that happens that can easily connect me and you.
Mm-hmm.
If that makes, I don't know what that is, but it's sort of, we understand the worth, don't we? And it's starting to happen in areas, but I think there needs to be, I don't know what that is, but I think there needs to be something that just connects us both more easily.
Yeah, and I think you're absolutely right. I guess one of the hopes would be the roles people like social prescribers. They're the ones who would really become that kind of that link between our community and our clinical services. I think the challenge that we have now for us working in general practice and probably in hospital settings as well is it's how do we turn you, to use that phrase that you use, Lee, how do we turn you from being a passive user of health to an active user of health? So, if I think forward 5 years, if we could get to a place where actually someone attends a practice and actually they're experiencing, when they arrive, they're invested in looking through what's available within their community, and then they have their health appointment after that. And part of that health appointment is saying, actually, did you see that? Have a quick look on the way out, or speak to our care navigator who's out the front who could help you. To me, that feels a good way of us sort of looking at it moving forwards. But I think it all comes back to, it's just about breaking down that real divide and split between where health sits in the community. Ultimately, I'm probably offering a community service, but it's not necessarily seen as that. So we need to think more in terms of community rather than us working separately from you.
Do you think, I don't know if this has happened actually, but do you think GPs, practices, surgeries could become sort of mini arts hubs in the future?
I don't think there's any reason why not. I think, if I think very closely about our practice, we've got issues about moving forwards, about with our building, and that's really exciting because we're really trying to deconstruct what it is that we do in general practice. But I think the best thing to do is to start to think of general practice as it's like a well-being space.
Yeah.
And when you start to think it's a well-being space, you can ask the question, well, who lives there and who exists in it? And I think that's that's probably where we get to, is actually saying, well, who could exist in there? So having art present in it, there's no reason why that couldn't happen. I think the bit that really interests me is when we we get people in for health appointments. I hate the concept of waiting rooms, because I think they're drab, they provoke anxiety.
Yes.
Everyone just reads the big branded health literature on the wall, which
is quite intense at times.
It's quite aggressive. Yeah. Absolutely. It basically says, unless you change your lifestyle, you're going to die.
Absolutely.
Plus or minus.
Yeah.
But actually, there'd be a really interesting thing that I'd love to explore with, actually, when you're in that space, when you're waiting to go in for a discussion about your health. It's how do you get someone in that right mind frame to really engage both with themselves, but also with their clinical work?
Absolutely. And I'm thinking, my creative brain's going now, God, there could be some cool sound installation stuff. People could be encouraged to listen to some stuff to get them, thinking about their own healthcare and their journey. And I just think there's loads of opportunity there. Which is exciting, actually. And I think from hearing what's going on with, personalised care and the social prescribing stuff, and obviously the stuff you're doing as well, it sounds like it's going to be an interesting time moving forward. And I think there is a role for Fluid Motion and also the festival in that, especially, in Basingstoke for us. But I think hopefully this conversation can encourage other people who might be working, quite loosely with the NHS in their area. It'll be interesting to sort of start to hear some of those conversations a bit more as a sort of to get a bit of an overview about what else is going on, because I was speaking to you the other day, wasn't I, Tim? And I don't, for me, it's an area of work that I don't quite know what's going on where. It seems to be quite sporadic, and I don't know if that's the funding model or I don't know what that is, organizational model, but for me, there's no sort of one area does it and everyone else does it. It's sort of everyone can take on, and each practice can take bits of what they want as well. I think that's also what people don't understand. I think people feel like, well, the NHS tells all practices to do a certain thing. Well, it's not the case necessarily, is it?
No. So I think I'd hold my hands up and say the NHS is a big beast. It's very complex. There are lots of different ways that funding comes down, and for someone who even works in it, I'm still learning about all those things, and it's taken me a long time to kind of understand it. And I think you're absolutely right that each practice ultimately has to deliver health services, but the way that they deliver that and who they have delivering it can vary vastly. I think probably where we've got to now, and this is certainly the direction of travel that's being pushed nationally, is actually we're working together in what are called primary care networks. So that's 3 general practices working together, or up to, it can be any number. It's usually based on the population size, and so that's giving us a little bit more clinical leadership over a wider area, and trying to look at bringing in these new roles and different people that can help support us. So I think there's probably never been a better time to really start to get stuck in. So I think, to anyone who was kind of listening to this and thinking, I've got this great thing that I'd love to have a discussion, I think most general practices would welcome you with open arms. With, hopefully we're seen as approachable, but we're always looking to think differently and start working differently. And if you've got a great resource that we can support our patients with, we'll always look at it.
So so if there are any artists watching this that maybe have an idea or have done some work, maybe as graduates at university or something, and they're like, how do I get started in this? You think just contacting general practice just in the first instance? So
I think, you can always go through a general practice. The other thing is, if you wanted to do it on a slightly larger scale, you could speak to, there are clinical directors who work as the leads for primary care networks. Similarly, if it's something that's happening in North Hampshire, drop me an email, give me a call, that kind of thing. I'm always more than happy to chat about anything. And I think I'm always interested to hear where people are positioning themselves, because I think there's a lot of stuff that we know happens in and around Basingstoke that is of brilliant community value. And I think it's just about us trying to bring that in to make it part of our offering. So I think everyone will be up for that conversation.
And if say I was a patient, and I mean, obviously it's going to be different for different practices, as we've just discussed, and I was really, really interested in writing, creative writing, and I was watching this, and I had suffered from depression, and I'm going, well, I didn't realise that could maybe be something that could actually help me in a clinical sense or a medical sense. could I just bring that up with my doctor, or how does that sort of work? Is it something that every GP would sort of know? Well, yeah, there is a link there, and we can put you in touch with these people that are social prescribers or enablers, or.
Yeah, so I think definitely. So everyone will probably look towards sort of the social prescribing as an element of support, and all GPs will know about that. I think one of the skills of being a GP, and something that you get sort of taught repeatedly in your training, is it really is trying to think about the person as a whole. So trying to look at them as an individual and actually know what works for them. So I think generally, if you bring up a discussion around something that you're interested in, you'll probably be surprised by how engaged and interested your GP might be, because we've aside from clinicians, we've all got interests as well, and often you can find a common ground, a common language to talk about something. But again, I think also they'll probably support you, or if not, say actually that sounds brilliant. Let me get you in touch with our social prescriber because they'd love to know about it.
And I think you're right there in terms of finding that common ground, because we've done some patient focus groups before for projects, and no offense, Tim, but what comes up is that people feel very alienated between, the GP is a very scary person for a lot of people, especially those people that have maybe got more severe mental health issues. And there's a barrier, first of all, coming into the GP practice, in my experience. So I think that maybe the arts could be just a stimulus for conversation in that space.
And I think you're absolutely right. And I think, there's more work for us to do as clinicians to really, to try and break down that sort of that challenge that people feel in coming forward to talk to us about things. I mean, I think, to give you sort of one example, I remember I had a fantastic conversation with somebody who has had long enduring mental health need, quite difficult at times for her to manage. But actually the way that we really got there was actually we started to talk about the book The Outsider, by Camus, kind of thing. And that was brilliant, because actually it's something we both read, it's something we both understood, and she could say, I feel like this person today.
Exactly. Yeah.
And it was, for me, I instantly knew exactly what she was talking about.
Yeah.
And she also gave me some amazing book recommendations as well.
And you're right, because the how you communicate how you're feeling is so hard. And I think if there is a creative output or a film or a character or a piece of music that you can use to explain that sort of the GP has an understanding of, that is so powerful and so useful in that consultation, isn't it? I'm just thinking, my own experience is that counselling was never. I never got on with counselling when I was going through my stuff, and then I made a one-man show about. Made a show about my experience, and because I was in control of my story, I felt with counselling, and I said this on another a Tent of Ideas discussion. There's nothing wrong with counselling, but for me, I felt that I was very much being told to sit there and I want to hear something and you'll tell me. That's how I felt. Whereas doing an artistic practice or doing theatre, for me, I was able to be in control of the narrative, and I was able to look at other art forms or creative experiences and go, I felt like that, I'm going to use that. So I think if there's one lesson from this chat, it's maybe that we need to just bring the conversation of art into the consultation room. I think that's a good tip.
Yeah, I mean, I think it's been really interesting. So certainly over the last 5 years, obviously general practice has been quite a difficult, stressful place at times, and certainly there's been a big question around sort of GP mental health. Because the rates of mental health amongst GPs is really high. So much so there's like a dedicated service for it through the NHS, to support them. But what's been really interesting is actually there's a lot of groups now about sort of GP resilience, and particularly a lot of them focus on sort of art. So I've seen some brilliant examples from down sort of, I think, the South Coast way, where actually they've had like painting groups for GPs that kind of go away on retreats, that kind of stuff, to really kind of center and ground them. And it's that classic thing where actually that's the kind of stuff that we know works for us as clinicians. So I think it's absolutely right to have a conversation with patients around what can work for you, because there's more than one way to solve a problem, always.
Absolutely.
And it has to, exactly as you say, Lee, there will be some elements that we will offer that won't work for people, for whatever reason. Some people don't necessarily like that face-to-face discussion around their mental health problem, because understandably that can be a difficult conversation. If we can find a way of allowing you to express it in a way that works for you and you feel comfortable, it will probably be a richer a richer, thing for you to be able to do.
Yeah, and I think I obviously I think the arts is the answer to everything. It's not all the time, of course. The arts can't heal a broken leg, can they necessarily? But I think having that package, that offer of multiple things for the patient, I think that's really interesting. And I'm keen on, sort of through the work we do and the festival, keen on seeing where that goes and how we can be part of that. In your I don't think you've been to All in the Mind before, have you? When it's been in the park?
No, I don't think I have.
I'll let you off.
I know. No, like all these things, Lee, I'm a classic example. Unless I probably didn't know about it, but through this recent work and learning more. Yeah,
and I'm just thinking, from your point of view, it might be. Where do you think? I mean, to give you an overview, it's usually a 1 day free arts event in Eastbrook Park that does attract national audiences. 35 performances roughly across the day, ranging from theatre to spoken word to music to dance, all around the theme of mental health in some way. And there's also the opportunity for live discussions like this. I'm just thinking where you might see that, how you might see that festival as an opportunity to sort of push this agenda of thinking more about the whole person and giving them sort of different options. I'm just thinking what you feel the festival could offer in terms of that.
Yeah, I mean, I think definitely, like all these things, it would be great to be there and be part of it. I think we are hopefully starting to adapt and change the way that we work. And I think one of the things is actually starting the conversation about what works for patients. So I think, there would be a really, really interesting for us to be present and actually start exploring with our patients, with our population, actually, what works for you. But we can also bring along new members of our team, like our social prescribers, like our reception teams are becoming much more engaged in trying to work within that patient journey. So trying to understand where patients' problem lies so they can put them into the best place. So really trying to kind of get a rich discussion, but also showcasing potentially what we have on offer. The caveat to that is that definitely we're never going to be able to offer everything to solve everything. And we are always open to bringing in different people to sort of work and support our clinical work, because it has to be holistic. It has to be really broad. So I think probably just being present and hearing and listening and seeing. And similarly, if people wanted to, if people had certain sort of things they wanted to do. So I know you mentioned about sort of, expressions or writing or that sort of thing. If you wanted to do it based around health or experiences, I'd be really interested in having a conversation about what that looks like. How do we look at it in practice? What can we do to support you to make that a reality? All those sorts of things, really.
And I think, hopefully that, this year we are able to go worldwide with this festival. And I hope that just this conversation sparks other people's creativity, going, oh, do you know what? I'm interested in talking to my surgery about that or that. I mean, that for me is also as important as making sure that the All in the Mind Festival is successful. So I'm excited actually about what this conversation could spark. We've got 3 minutes left, Tim. Got 3 minutes left. It's gone quick. I was thinking about, what would be nice to end on. And I just wonder whether or not, I don't know how, if you want to do this, but maybe sort of trying to describe what the arts does to, what creativity, what that sort of creative activity does to the brain in terms of sort of, from a medical point of view. I don't know, is that something you could do in terms of, because we in our practice we talk about breathing, more mindfulness. It does this. It releases endorphins. It blah 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 blah. It would be just quite nice to get that maybe vocalised from a GP. I don't know.
And I can certainly give it a go, Lee. I'm certainly, I was never great at physiology at medical school, so we'll give it a go. I think it'd be nice for people to hear, what actually doing those sorts of, even if it's sport or physical activity or mindfulness, and the arts obviously fit into that, what that actually physically does to a person. Yeah. And I think, if I start at the most basic level, I think about a time when we felt calm and we felt rested, and that, that can take on any form, and obviously the arts can help that. I'm a big believer that things that kind of occupy your hands, there's a very good link between actually things that you do that use your hands and basically turning off different parts of the brain to make you a bit more sort of relaxed into a more relaxed state. You're absolutely right when you speak about sort of hormones. So at the base of it, we are just animals, that sort of thing. So we have a very basic sort of fight or flight response. So if we're scared and worried, so if we've got acute anxiety, we're concerned about something, our adrenaline levels go up. Adrenaline will make you feel stressed, it will make you feel anxious, it will make your heart race, do all sorts of things. And what we're trying to do with sort of mindfulness or any sort of management for anxiety is we're trying to turn off that fight or flight response. So, good quality psychotherapy basically starts to teach you the ways of understanding when those things are present so that you can calm yourself so that those bits don't turn on. So trying to turn off that sort of very traditional sort of animal response to sort of fear or worry. I think you mentioned around sort of exercise, those elements. So exercise, we know, releases lots of endorphins. Endorphins are the things that make you feel good. I think it's also probably, it's very, if you exercise, it's very hard really to think about anything else. So it's a way of sort of distracting yourself from the present, which obviously, in the sort of the acute setting can be really valuable in terms of just giving you the breathing space and the head space to step away from it. I think those would probably be the two things I described. So think about it in terms of adrenaline. So basically trying to turn off the tap of adrenaline to give your body some time to rest and recover. And then also from the endorphins, so trying to do things that release endorphins, which are those natural things that will make you feel better about your situation.
I think that's really useful. And I'm thinking about when we sit physical activity and art or creating art, actually they go hand in hand, because, when we're, for example, creating a piece of theatre, there is quite intense warm-ups at the start of that. It is about getting your body moving. So, so they are all interlinked. And I think, we could talk for far longer about some of this stuff. And I know 30 minutes doesn't seem like a right amount of time actually really to delve in. So maybe next year at the Physical Festival, it'd be great to have you come along and maybe we can chat about this a bit more widely. But that's 30 minutes done, Tim. Thank you.
Pleasure.
Thank you for coming and talking. I hope this sort of gives people the opportunity to think about maybe the role of the arts in arts and mental health in a clinical setting a bit more, and inspires people to sort of start having conversations with their GPs and the NHS and their practices. Thank you, Tim, for giving up your time to come talk to me, and I'm sure we'll see you at the virtual festival this year.
Pleasure. And as I say, Lee, what I'll do is I'll give you my contact details. So if people do want to, if you've got an idea or an interest, let me know. We can always have a conversation about it.
Brilliant. Thank you so much, Tim.
Good to see you, Lee.